All right, good afternoon, everyone. My name is Dr. Nolan Quinn, and I'm the President and CEO of SickKids. And it's my honor to be here with you and welcome you to SickKids on a very, very special day. I'd like to begin by acknowledging the land on which we stand. It has been for years the traditional land of the Huron-Wendat and the Petun First Nations, the Seneca, and most recently the Mississaugas of the Credit River. I'm thrilled to be joined today by the Honorable Deputy Premier and Minister of Health, Sylvia Jones, Nolan Quinn, Parliamentary Assistant to the Minister of Children, Community and Social Services, Irene Andres, Vice President of Programs and Services and Chief Nursing Executive at Holland Bloorview Kids Rehabilitation Hospital, and our own Dr. Simon Kelly, our Associate Chief of Perioperative Services, to come together and recognize the Government of Ontario for their transformational investment to support pediatric care in Ontario. I'd also like to acknowledge Kevin Edmondson, VP Clinical Programs at Michael Garron Hospital, Marisa Cicero, who is the Senior Clinical Director in Women's and Children's Health at Unity Health of Toronto, who are also joining us today. Here at SickKids, our passionate and dedicated staff work each and every day to provide the best care for our patients and families, create groundbreaking clinical and scientific advancement, and train the next generation of children's health experts. However, each year we find ourselves facing new hurdles, more patients, new complexities, and higher acuity, further strained by the incredible challenges posed by the remnants of the pandemic that we all experienced a few years ago. Despite the best efforts of our world-class teams across SickKids, we have been faced with a number of critical gaps. Significant wait lists for care in a system that really for years has not been able to keep pace with the growing needs of our children and our patients. That is why we are so thrilled and honestly grateful to welcome Minister Jones and Nolan Quinn here this afternoon for this very special and important announcement. Thank you, Minister, for being here today, for your commitment, steadfast commitment to the children and families of Ontario and SickKids.
Well, thank you, Dr. Cohn, and it really is indeed a pleasure and an honor to be back here at SickKids. Thank you for hosting us. And thank you to the entire team at SickKids for everything you have been doing and continue to do to provide exceptional care to patients and their families. I am, of course, pleased to be joined today by MPP Nolan Quinn, who is the Parliamentary Assistant to the Minister of Children, Community and Social Services and doing exceptional work in a critically important file. As well, of course, my Parliamentary Assistant in Health, MPP Robin Martin, who has been a champion both in the health space since serving as Parliamentary Assistant since 2018, but of course her community as well at Queen's Park. I want to discuss how our government is making it easier and faster for Ontarian families to connect to pediatric care. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Earlier this year, we launched our Your Health Plan to connect Ontarians at every stage of life to more convenient care options. Through our government's plan, we are taking bold, innovative action to build a healthcare system that puts people at its heart by reducing surgical wait lists and wait times, growing our healthcare workforce, and providing significant financial supports to hospitals, clinics, and communities to improve how they are able to deliver pediatric care. We are already starting to see the impact of the change our government has made in our healthcare system. Pediatric surgery volumes have increased and are continuing to improve, reaching 90% of pre-pandemic levels, with 3 of Ontario's 5 pediatric hospitals operating close to or above 100%. We have also worked to permanently increase pediatric ICU capacity here at Sick Kids last winter to help with the pediatric respiratory surge. Today, I am pleased to announce that our government is continuing to build on our progress by investing over $68 million to provide greater access to services for children and youth so that they can connect to the care they need when they need it, right in their own communities. Our investment provides consistent and stable annual funding to support programs and services at the Hospital for Sick Kids, Holland Bloorview Children's Rehab Hospital, the Centre for Addictions and Mental Health, Toronto East Health Network, Unity Health, Surrey Place, Grandview Kids, and the Children's Treatment Network of Simcoe York, ensuring they have the people, the resources, and the technology they need to improve access to pediatric care and prevent backlogs. Specifically, this investment will improve timely access to care by supporting the hiring of more pediatric surgical staff and additional registered nurses to support increased patient volumes and complexity, while expanding access to operating rooms, MRIs, and CT scans, and adding more rehabilitation beds. It will also increase access to specialized service in the community, including support for those with mental illness and psychosocial supports for children and youth with cancer. The funding announced today that will connect children and youth to care close to home is part of our government's historic $330 million annual investment in pediatric health services at hospitals, in clinics, and community-based healthcare facilities across Ontario. With over 100 high-priority initiatives that are being implemented across Ontario, connecting children and youth to emergency care, surgeries, ambulatory services, diagnostic imaging, and mental health services. Our government and pediatric healthcare and community partners all share a common goal of working together to improve healthcare for Ontario's children and youth. And through our record investment, we are ensuring children and their families can access care easier, faster, and closer to home now and for years to come. Thank you again to our incredible healthcare workers here at Sick Kids and across Ontario who provide health and support for youth, children, and families every single day. It is now my pleasure to turn it over to Parliamentary Assistant Nolan Quinn. Thank you. Stay well.
Good afternoon. Thank you for that kind introduction, Minister Jones. I'd like to thank everyone for joining us today, and a special thanks to the team at the Hospital for Sick Children for hosting us and their dedication to helping children and youth and their families. I also want to recognize the outstanding work of Toronto's pediatric hospitals and community-based children's rehabilitation agencies who are working together to support children and youth and their families. You are helping children, youth, and their families throughout their health journey with respect, care, and compassion. Premier Ford, Minister Parsa, and our entire government shares this commitment. We are putting children and youth first to ensure they receive the care they need when they need it. We are making investments that support early intervention services through child and family-centered rehabilitation services, help families cope with their day-to-day challenges, and make access to services more coordinated, more efficient, and more likely to lead to better outcomes. We are continuing to support our most vulnerable children and youth by also investing in modernized facilities at children's treatment centres and children's rehabilitation agencies across Ontario. This past summer, Minister Jones and Minister Parsa announced an additional $330 million in pediatric health services to connect children and youth to more convenient and high-quality care close to home at hospitals, clinics, and community-based healthcare settings. As part of that announcement, we included up to $45 million for children's rehabilitation services such as occupational therapy, physiotherapy, and speech and language services, and post-surgery rehabilitation services. Children's rehabilitation services in Toronto are receiving nearly $2 million this year to hire and retain more staff to deliver more services and reduce wait lists. More staff means more access to clinical assessments, early intervention, and children's rehabilitation services. It means less time waiting for services It means quicker recovery and better quality of life for children and their families. We will continue to work with the families and sector partners to strengthen and improve services and supports for children and youth with special needs. Together, we will help our children and youth grow into thriving adults in communities across Ontario. Thank you again for your partnership and dedication. I would now like to welcome Dr. Simon Kelly to share some words.
Good afternoon. So we know that delays in surgery for children can have a devastating effect on their long-term health of our most vulnerable members of our community. Delays to surgery in children can lead to them missing really important developmental milestones. This can lead to setbacks in their mobility, fine motor control, their sight, their speech, and their hearing. We also know that delays can cause deterioration in their condition that can lead to more complex surgeries. And we know that more complex surgeries can lead to a higher rate of complications. And so it's absolutely critical that we provide a timely and equitable access to surgical care for children. However, it's not just the child that's impacted by the delays to surgery. This is a situation that impacts their whole family. It impacts the caregivers, it impacts their siblings, it impacts the extended family and their friends. In fact, this is a situation that affects our whole community. And we know that for families who have a child who's waiting for surgery, this is a very anxious time. It causes untold anxiety for caregivers to feel that their child is missing out on life. They're missing out on team-based sports, play dates, sleepovers, and just zooming around on their bike. Life really does go on hold when a family has a child who's waiting for surgery. It affects the employment of the caregivers, it affects vacations. We have families who don't go on vacation because they're too afraid to miss that critical call from sick kids to schedule a long-awaited surgery. And this is why it's so important that we deliver the right care in the right place at the right time. And so on behalf of the entire perioperative services team here at Sick Kids, our surgeons, our nurses, our anesthesiologists and our support staff, we're extremely grateful for this announcement today, because it's really going to help us start to right-size pediatric surgical services. So at Sick Kids, this increase in resources is going to allow us to achieve a number of things. Firstly, we'll be able to keep our operating rooms fully open Monday through Friday in our regular work week. It's going to allow us to renovate and build new spaces to provide more surgery. It's also going to help us develop innovative solutions for delivering surgical care for the children of Ontario. And finally, build new relationships with our community hospitals so our children can get care closer to their own communities. So I'll give you one example of something that we're doing. It's our new weekend elective surgical program. This means 7 of our surgical specialties are able to come in on the weekends and perform daycare surgeries. This is something we've never been able to provide before, and it's a first critical step in reducing the wait times for surgery and start to reduce that surgical backlog. So if we truly want to take care, the long-term care of the health of our community, what better place to start than with the health of our children? And providing timely and equitable access for surgical care is a really great first step. Thank you very much. So now I'd like to introduce Ms. Irene Andrews. So Ms. Andrus is the Vice President of Programs and Services and the Chief Nursing Executive at Holland Bloorview Kids Rehabilitation Centre. Thank you.
Thank you. It's a privilege to be here with you today. Minister Jones, Parliamentary Assistant Nolan Quinn, Dr. Cohn, Dr. Kelly, and fellow colleagues and partners. I join you today as a very proud member of the Compassionate Care Team at Holland Bloorview Kids Rehabilitation Hospital, where we serve youth and families with disabilities, developmental differences, and medical complexity. Holland Bloorview is honored to be part of this community. As each of you know, every day matters in the life of a child. And it is only through true partnership across the system, from acute care to rehabilitation to mental health to the children's treatment centers, that we can truly make every day count and improve the care and outcomes for children, youth, and their families. This once-in-a-generation investment by the Ontario government to right-size the pediatric healthcare system has enabled our specialized teams to support the healthcare system in even more effective ways by increasing patient flow from acute hospital to rehabilitation. As a result of the funding, Holland Bloorview has added 4 new inpatient rehabilitation beds and increased capacity on our complex continuing care unit. We've increased capacity in our day program, which enables us to transition patients from inpatient rehabilitation back home more quickly, create additional capacity in our inpatient rehabilitation units, and serve more clients from the community that require more intensive outpatient services. We have launched a new neurodevelopmental and sensory stream into our outpatient feeding program. And finally, this funding has enabled us to expand our outpatient areas where we're experiencing historic waiting times, and the demand for service continues to grow. This includes our neuromotor, neuromuscular, and spina bifida clinics. To make all of this happen, clinical staff across a diverse array of disciplines have joined our care teams, including nurses, therapeutic recreation specialists, and physicians. To date, we've hired more than 40 healthcare professionals, and more are on the way. We recognize at Holland Bloorview that the care we provide needs to be agile, adapting to the individual needs of each client we serve. This investment allows us to meet the evolving and complex behavioral and psychosocial health needs of children and youth with disabilities, developmental differences, and rehabilitation needs. Once again, together with Sick Kids and our other healthcare partners in Ontario, we are so excited to continue building capacity for change so that all children, youth, and family can look forward to the most meaningful and healthy futures. Thank you so much. And now I would ask Dr. Ronald Cohen to return to the podium to provide closing remarks.
Thank you, everyone, for joining us here today to recognize this historic and transformational investment for Sick Kids and so many other healthcare institutions in Ontario. You've heard from Dr. Kelly here from Sick Kids, but really from also my colleagues, that we have been under considerable strain with critical gaps, and all this obviously exacerbated by the pandemic. With this investment that we have heard about today, we'll optimize our operating room capacity, not just at Sick Kids, but in newly formed partnerships with our community that will increase the surgeries here as much as in the community. And that is one of the examples of where we show all of you that we do things differently. We're not just trying to do the same thing over and over again. These are new, innovative ideas that are tackling this untenable problem. In addition to our surgical areas, we are also increasing our activities in the emergency department. We are increasing our virtual urgent care platform that really ensures that families can connect with us here before making a decision of whether they actually have to physically come here. The impact of these funds will be far-reaching and enable us to deliver the world-class care that we are known for and that we are striving for. But working really together in a robust learning health system that has the potential for remarkable outcomes for our patients and their families here at the hospital, but really also with our partners across the continuum of care and beyond is what I'm personally, and I know my colleagues also, are so excited about. Mr. Jones and Mr. Quinn, on behalf of everyone here at Sick Kids and my colleagues from our community, thank you for your time. Most importantly, thank you for your commitment to our children here, as well as all in Ontario, and I'll now pass it to Abby Horrigan to moderate questions for the media.
Thank you. We do not have any questions today, so we will just do a group photo now.
Good.